And please make sure you scan the QR code displayed.
Hello. Good evening, ladies and gentlemen. May we please settle down? We're about to begin the CHIA Innovation Awards ceremony. We're about to begin the CHIA Innovation Awards ceremony.
Ngoja mna. Na dakika ngapi?
Good evening, ladies and gentlemen. If you have colleagues outside this hall, please notify them to come inside. If you have colleagues outside this hall, please remind them to come inside. We're about to begin. May we please settle down? We're about to begin. Okay, good evening, ladies and gentlemen. So we are commencing the CHIA Innovation Awards. And to set us off, allow me to welcome Mr. Yohana Nyanza to give us an introduction of the CHIA Innovation Awards. So he'll give us the brief of what it is, its evolution, and what it does. So Mr. Yohana, welcome to the stage. A round of applause as he joins us on the stage, please.
Good evening, everyone. Good evening, everyone. I know you seem tired, but we are going to see a prestigious thing, which is CHIA Innovation Award, one of the best things in Tanzania Health Summit. Why it is called CHIA, and why CHIA Innovation Awards? Why I say that it is very important. CHIA Innovation Awards has been launched in 2020, is one of the prestigious platforms designed to recognize and celebrate the most impactful healthcare solution in areas of accessibility, service provision, and affordability. So you can see it tend to see every kind of quality health services, means that in terms of accessibility, service provision, and affordability. So we are seeing the solution, the local solution in our areas, and we see the young innovators, young people, young talents who can innovate and give out the solution of our healthcare system. So as an award, Tanzania Summit tend to provide 5 million for the best innovation during the summit each year. And this award aims to recognize young individuals that has potential to improve healthcare delivery. So you can see how important the CHIA award is. And you can see how it tend to shape the healthcare services in our country. So the journey of CHIA awards, first of all, these young innovators, they submit their application, and on June, we got we got this submission of them, and they provided their innovation. We assess them. The judges, they tend to score and select 10 shortlists. After there, these young innovators, they tend to enter in live pitch competition, and it was done on September. And we got the 3 finalists, and those 3 finalists will be presenting today. You will see how they are so energetic, have power, and they have innovative minds to provide solutions for our day-to-day life healthcare services problems. So it's how we give them chance to acknowledge their potential and show what they have. So since 2020, we are having the best innovations, and those innovations, they are doing good work there in the market, but also in provision of services. Some of them, there is Jaledi Haago, the previous winner, and for those who were in the THAs on last year there in Zanzibar, you saw how this person was. He make a good suction machine there, which it's a good thing, and using his mind, he designed an automated suction machine. There is also FarmLink, there are other men there in the community, and they are doing good things. So it's one of the best innovation here in Tanzania Health Summit, but also it has a great impact to the health delivery there in the community. So, as how I've said that, we got 3 finalists, and those 3 finalists will be presenting today. You will see their best ideas, you will see their innovation, and there now you can know who had the most influential and most prestigious innovation which can solve problems in our hospital settings, but also in the community. So there is Neonatal Care Bundle, who this designed the 3 local medical services to manage newborn complication, hypothermia, sepsis, and jaundice. We also Parasitus AI, you will see their presentation. Banana Goals, called Baggers. You will see the presentation, and there now you will be able to choose which among those 3 finalists will be a winner of 5 million of CHIA Innovation Award. Hand of applause, and I wish you good luck to listen this presentation of our innovators. Thank you.
Thank you, Mr. Yohana, for that brief introduction. Now, the atmosphere in this room is a bit cold. which is making the coming innovators nervous. So can we please bring that warmth so that they won't get nervous on the stage? They're going to pitch for 5 minutes only. Each innovator gets only 5 minutes strictly, and I'll interrupt you when the time is off. So what we're going for right now, the innovators will come up here, they will pitch for 5 minutes. Afterwards, you, the audience, are going to decide who is going to walk off with the 5 million Tanzanian shillings. So, when I call out the first innovator, can we please give a very warm and loud round of applause to release the nerves. So allow me to welcome Mr. Kaskana Nixon. He's going to pitch about Parasitus AI.
Good evening, everyone. I'm Nixon Kaskana from Parasitus AI, and you can switch. Okay. Yeah, so good evening. I'm Nixon Kaskana from Parasitus AI, and what you see there is a mosquito, and this is among the deadliest organisms that has been recognized by the WHO. And from it, I want to tell you a story that grabbed my attention to come up with this innovation. Okay, I want to tell you a story that grabbed my attention to come up with this innovation. So it was on the year of 2023 where my sister succumbed a life-threatening condition of chronic kidney disease due to the effects of malaria. And this was due to the less accurate and time-consuming malaria diagnostics, such as the use of the traditional microscopy, which is prone to human errors due to the exhaustion that most of the lab scientists face during the high-peak malaria seasons. And also MRDT, which at times tends to miss infections, but of which it is prone to human errors. So as it was stated by the WHO that in the year of 2023, about 263 million people were infected, of which 94% of the cases and 95% of the deaths were from the WHO African region, and 76% of the deaths were from the children who are under 5, of which is approximately about 396,000. So there is where we came in with Parasitus AI, where this is an artificial intelligence software that scans the blood smear images and comes up with the results in less than 2 minutes. And here is how it works. So the lab technician, can you play? So the lab technician will be able to log into the platform, and for new users will be able to register by writing their names or the facility's name, and we'll write the password and confirm the password for further security. We are using multi-factor authentication, and from there, as a lab technician, I will be able to log into the platform. Yeah, so as you can see, there are multiple functionalities for lab technicians, from uploading the slide to live microscope. So for now, I will upload the slide, and first of all, I will choose the patient and a diagnosis, and from there now, I will upload my slides. As you can see there, as I upload my slides, it also allows for a person to upload multiple slides so as to view different fields of a microscopy. And when I start the analysis, in less than 2 minutes, it gave out the results showing the specific type of parasite and also the parasite lot. But also we have employed the technology of GradCam, which shows the area of which the AI has interacted, of which this helps to improve the interactivity with the healthcare provider, but also to improve trust. And what sets our solution apart is that we are able to provide high and consistent accuracy, but also we offer clinical support based on the WHO guidelines, but also we are able to identify the specific type and number of parasites. But also we provide digital records which are essential for malaria elimination strategies and policy making. And our serviceable obtainable market currently, we are targeting an entry-level market of 5 hospitals and 1 research centers as pilot, but we are looking forward for a national rollout after 3 years and a total addressable market of the sub-Saharan Africans, especially with the clinics, hospitals, and research centers. And our business model is a B2B business model whereby we are going to sell our software in terms of subscription method, but also we have digital cameras which are going to be mounted on the microscope, and also the PCs and the tablets which are optional in case the facility does not have them. And up to currently, we have managed to partner with MOAS through its incubation program, and we have accessed the funds from the Action Media, but this year we have managed to participate in the Dar es Salaam International Trade Fair, where we gained visibility and user feedbacks on how to improve our model. But we are looking forward for the upcoming year to be able to start our piloting, and in 2028 to advance to national rollouts and also improve our AI model to multi-disease detection apart from malaria only. And we are currently asking for 5 million from CHIA Innovation Awards so that we can develop our AI model by purchasing GPUs, monitoring communication, and also pilot testing. And here is the team of dedicated members that are able to advance Parasitus AI. And thank you everyone for listening, and thank you to our collaborators. Thank you. In case there's a question.
Thank you, Nixon. There won't be any questions today. So before we proceed, there's an announcement. If anybody has seated next to one of those conference bags that does not belong to him or her, can you please raise your hand? It's here. Thank you. Can somebody come get here? Okay, so we're going to proceed. For the innovators, we apologize that the pointer cannot respond. It's a very long range. But in case you need the slides to keep moving, just signal to the guys at the IT area, and they'll be able to push forward the slides. So up next, Gloria Mroso with Neonatal Care Bundle. A big round of applause, please. Thank you. Welcome, Miss Gloria, and you can start.
Greetings, everyone. My name is Gloria Mroso, and may I present to you Neonatal Care Bundle. The picture you see is Mama Zawadi. If you are to ask her what's the most painful thing that she had to experience in her life, is that she carried pregnancy to term, see her baby fall sick, and finally losing her child. It could be her only child, it could be her first child, or a long-awaited boy or girl that she had hoped over so many years. Yet, I observed that as a junior doctor, this often comes after long hospital stays, heavy financial bills, and the grief that is normally directed to the healthcare workers despite their endless resuscitation and efforts to save this child. And that we make big efforts into newborns, but we forget the most simple yet practical and easily implemented solutions, and that is what has brought me here today. So Neonatal Care Bundle is a set of 3 most basic medical devices that are designed to address the main causes of illness and death in newborns and the complications of prematurity, such as hypothermia, neonatal sepsis, and in management of jaundice. Nearly half of all deaths of children under 5 years of age will occur in the first 28 days of life, and it is aggravated by the lack of these critical supplies. So we observed that, we observed that newborns lack a neonatal eye shield to cover them while they're undergoing phototherapy management. Newborns also lack a nesting tool that is going to facilitate them during the transportation and to prevent hypothermia. Also, we observed newborns who are in radiant warmers lack a specific net that will cover them for external environment. So to counteract all these 3 problems, we came up with the neonatal eye shield, which we have tested its effectiveness to block the blue light rays. It is reusable, economic, and it improves the mother and child bonding during breastfeeding. We also came up with the neonatal nest, which will prevent hypothermia, providing warmth, and it's recommended by the WHO in limited resource settings where they cannot afford the expensive infant radiant warmers, which sometimes do not work and may cause troubleshooting by causing overheating to these babies. We also made a special net that could be hung in radiant warmers to cover these babies from the external environment. So our target market includes all healthcare facilities that offer maternal and child health services, and if we are to supply only 20 neonatal care bundles in 200 healthcare facilities, we are going to run that amount of revenue, and with this pace, we are going to cover about 8,000 newborns annually. We are going to scale and remain sustainable by direct sales, e-commerce platforms, and establishing partnership with healthcare organizations, which mission is to improve health in newborns. Our value proposition includes that all our 3 products are easily accessible, affordable. We are making them locally than the available solutions. Currently, we have the functioning prototype of each of the product, and we have a patent, and we have tested it, and we are seeking 5 million funding so that we can get into the market. And we look forward to make all these products to all parts of Tanzania so that we can reduce disease burden among newborns and death, but also bearing in mind that 95% of medical devices are currently imported. So by supporting us, we are going to reduce this dependency, boost our manufacturing sector, create more employment. Let's remember that healthier babies lead to a more economically stable families, breaking the cycle of poverty in Tanzania. That is my team. I am a medical doctor by profession, and I have training in textile and dressmaking, and thank you so much.
It's plausible that all the presenters are well within 5 minutes. Thank you so much, Ms. Gloria. Now the last but definitely not least, Dr. Noni Ntindigwe with Bagazi goes. Same will be for you. If you need the slides to move, just signal to them.
Good evening, everyone. My name is Dr. Non Tindigwe, Medical Officer and a Public Health Institute. So I bring to you the banana gauze, which is made from the banana fibers. As you have observed with the rising burden in non-communicable diseases, we have got nowadays a large number of patients who are coming to the hospital in the surgical department because of chronic wounds. And when you look in data from Tanzania, from 1999 to 2019, you had doubled the number of patients who are presenting with chronic wounds and non-healing wounds. Yet, in the lake zones, they have been using the banana leaves for wound dressing, and it has shown positive impact for leading to rapid wound healing. The reason behind it is the banana leaves have a neovascularization property, and some hospitals have employed it. For example, if you visit to Bugando, they did a study in 2023, and they employed it for treating pediatric patients with burn wounds. So I bring to you the Baga's wound. The Baga's wound, which I'm bringing to you, is this one. You can feel it, you can taste it, and have the texture. You can see it. So we do make the banana goes from the process of taking the stem of the banana. We aren't using the leaves because the leaves, they lack the cellulose, which is a main property for making the fibers. So we do take the stem, we chew up the juice and make the fibers, then we dry them. After drying them, we do crush them and grind them, then decompose them, forming a white pulpish material, which we now use for producing the banana gauze, after which we do sterilize it and ready for using it in hospitals. And it has shown to have the same impact as it is for the leaves, which is it reduces the number of hospital stays for more than 80%. It increases neovascularization and rapid wound healing by 60% from the trial. And also it is 100% biodegradable. That is, it leaves no waste to the community or the environment because it composes to soil completely by just disposing to the ground. And also it is 100% compatibility for the clients who tried it. And we are producing it from the waste because, as we know, the banana gives birth to only once per year, and when they give birth, they have to be cut down and be collected as waste. So we go there and collect the waste, which are the stems, and then we do use them for making this product. So why am I here now? I am here now because I want to make this impact everlasting to everyone to reach it, and from this impact, we are going to reach every department of surgical, especially from the primary healthcare where they are unreachable. And my team here has a lot of who are well-trained experts in the area of supply chain, and we have our background who are mentors, both national and international. And why I want you to vote for this one, I don't want you to vote this because I'm pitching for the 5 million, but I want you to be part of this life-changing solution. I want you to be part of people. One day you're going to stand somewhere and say, it is because of me. People are having short stay in the hospital because of food. It is because of me. This life-changing solution is existing in this community. So I want you to make this a CHIA award winner so that we can be given this money to raise the capital so that we can bring this solution to your family. Thank you so much for listening to me.
Thank you so much, Dr. Noni. We have 1 minute to spare. Thank you for the time management. Now, a simple announcement. If anybody has seen car keys to a Mazda car around where you're seated, please raise your hand. Car keys to a Mazda. As we're searching, now we're going to distribute pieces of paper. The paper is going to contain a code. You use that code during the voting process. Everyone's code is unique, so everyone who wants to vote has to get that paper. So they're going to pass around. As we're passing around, may I welcome Mr. Johanna. He's going to give us a brief of the entire process of the voting system.
So while voting, as you can see that you have two options. The first one, you can click the link, vote CHIA voting. You can see that the first link, or you can scan the QR code. I think that is the simplest way. Just scan, and it gives you the option of putting that numbers. That numbers is on that paper. Have you seen that paper? Everyone has it? Not yet. So they are proceeding to give you, and that number will give you the light for you to vote the most promising solution. So I hope this is a good chance for you all, and you can choose. So this will only take just 10 minutes. After there, you will see the results. Thank you.
So we have a strict timer that is going to be set. Beyond that, nobody else will vote. So please, let's make this time worthwhile. And nobody can use that code out of here. It's only a one-time use. The link is not working? The window is not yet open. Okay, so they're setting it to begin soon. Meanwhile, let us contemplate on the three pitches and let the best one win the 5 million Tanzanian shillings. Can we see the QR code displayed, please? Okay, for those who are in need of the Wi-Fi service, the QR code is the evaluation form. May we display the QR code? Have we all seen the QR code? In case of any help, just raise your hand. And if you need Wi-Fi, no, not. The Wi-Fi password, so the Wi-Fi name has yes on it. Could you please raise your hand and the people will come to you? So the Wi-Fi name is Wi-Fi by Yas Tanzania, and the Wi-Fi password is capital Y for Yas, and then capital B, business, 123. So it's Yas business 123, but capital Y and capital B. Have we all scanned the QR code? Is there anybody with a challenge? May we please display the QR code? So if you manage to open the QR code, you see the voting ends in 7 minutes, so we have very little time left. We have Gloria Mroso with the neonatal care bundle. We have Kaskana Nixon with Parasitus AI. And then we have Dr. Noni Ntendigwe with Bagazi Goes. So one of these three great innovators is going to walk out with 5 million Tanzanian shillings. May the best pitch win. And how do we know the best one? It's determined by the audience in this room today. Is there anybody having trouble with the system? Please raise your hand. Five minutes and counting. I somehow feel like I know the winner of this award ceremony. Do you guys know? Okay. Very soon we'll find out who's going to walk out with the 5 million Tanzanian shillings. And we hope for the innovators you'll make it worthwhile. It's not money to go spend on vacation. I hope you'll advance your innovations and help them solve healthcare challenges as you promised in your pitches. Two minutes and a few seconds. If there's anybody experiencing challenges with the voting system, please raise your hand and we'll help you. Are we all done with the voting process? So in about 1 minute, the program will tell us who's going to win. So this platform doesn't only serve the winners. Even for the ones who will not win the 5 million, it's a great platform to display your work. And from here, you could get potential partners and potential investors. So it's not a loss. You didn't win the money, but you won the exposure. And we have very few seconds left. Innovators, are you ready to find out who won? Three, two, one. Okay, so the voting process ended. As you have all seen, the winner is Dr. Noni Ntindigwe. A big round of applause for Bagazi. And the first runner-up is Miss Gloria Mroso, followed by Mr. Nixon. Many, many congratulations to the innovators. Now, to present you with the award, allow me to welcome on stage the ones who will be presenting you with the awards, dear innovators. First and foremost, your very own Chief Judge, Ms. Marsha Makatayambi, who is also the Executive Director of the UN Global Compact in Tanzania. A round of applause, please. We also have Professor Kamalogo, a retired World Bank Health Officer. Please join us to the stage, Professor Kamalogo. And then we have Dr. Omari Chilo, the President of Tanzania Health Summit. A round of applause, please. It's the reason you're all here. So we'll start with the award ceremony. May I welcome on stage Mr. Kaskana Nixon, who pitched Parasitus AI. Many, many congratulations. From here, you'll very well secure partners and potential investors. Not necessarily the 5 million, but this is a start. Many congratulations, Mr. Nixon. We hope Parasitus AI will grow. Yes. And then may we have on stage Miss Gloria Mroso with Neonatal Care Bundle. A big round of applause, please. So we hope that you'll take it further and the future of maternal and child health would be brighter. And then may we have on stage the winner of the CHIA Innovation Awards. May we have a standing ovation, please. May we all rise for the winner of the Innovation Awards, Dr. Noni Ntindigwe. A big round of applause, please. May we stand as he joins on stage. Many, many congratulations, Dr. Noni. Many, many congratulations, and we believe that Bagazi will help us serve healthcare even in low-resource settings. Dr. Noni, people are declaring that they know you in the audience, so yeah. Many, many congratulations. Wow. Wow. As we're about to conclude, may I have all the three innovators take a picture with our three. May we please join the stage and get a group photo? The three innovators, please. So as the photo session is proceeding, may we please continue searching for the car keys of the Mazda, please. Okay, I said that I kinda knew who was going to win. How many knew that Dr. Noni was going to win? Okay, another round of applause, please. Thank you so much to the innovators. It was a long run from the screening process until you got to pitch on this stage, and finally we have the winner. So thank you so much, everybody. You're the one who determined the winner of this Innovation Award. After here, we have the cocktail session. It will be right outside, and everyone is encouraged to join in that cocktail session. It's a great opportunity to network. But for those who...
We have the special cocktail session for self-care partners that will be hosted at Mount Meru Hall, upstairs. So while I come on a special invitation here, self-care, please join us at Mount Meru. The rest of the members, CEOs, delegates, please join us for cocktail at the lobby. Karibuni sana, enjoy your cocktail. Asante sana.
Tukacheze mziki jamani.